Okay, so good morning everyone. Today we will start our case discussion session, starting with this female patient, 7 years old. Okay, MRI was requested. I will not tell you what was the complaint. You will tell me what was the complaint. Okay. So go for it. Start. It was a bilateral hip MRI. And what do you think is going on here? It's a relatively straightforward case. First of all, this is what?
This is MRI of the hip joint.
Okay.
Of a female child.
Okay. Coronal, axial, sagittal.
This is coronal.
T1, T2, T1 Fatsat, T2 Fatsat. What? Contrast, not contrast.
T1.
This is the bladder is what?
It's echogenic.
Is hyper intense. We don't say echogenic in MRI. Echogenic. Listen. بالultrasound you say hyperechoic, hypoechoic, or echogenic,
yes.
Anechoic. In the X-ray, in the CT scan, in the fluoroscopy, things that use X-ray, you say hyperdense or dense and lucent. In the MRI, you say hyperintense, hypointense. Every modality has its descriptive terms. Okay, so the bladder is hyperintense.
Yes.
On what we see the bladder hyperintense on T1 or T2?
T1 contrast.
On T1 contrast or T2. Fluid is hyperintense in T2.
Yes.
So we don't start with contrast. We start without contrast.
Yes.
We start with T1 or T2. In T1 it's hyperintense. In T2, in T1 it's hypointense. In T2, hyperintense. This is hyperintense, meaning this is
contrast.
This is T2.
Yes, T2. Sorry.
Okay,
yes.
We don't start with contrast. Contrast after we find something we give contrast.
Yes.
مو أول ما نبلش بكونتراست. تمام؟
Yes.
So this is coronal T2 weighted pelvic or hip bilateral hip MRI showing
There is abnormality in the right hip joint, showing
which part of the hip joint?
Head, femoral head.
Which part of the femoral head?
Epiphysis of
Yeah, the
femoral
capital
head.
femoral epiphysis is abnormal.
Yes.
Okay, what's the abnormality? Describe it.
There is abnormal intensity, hypo and
Hypointense
on T2.
on T2, exactly. What about T1? Let's see T1. Wait. Off the mouse. T1. Where is the T1? This is the T1. Let's see the T1. What does it look like on T1? It's what?
It is
Also
it's also yes.
hypointense.
Hypointense.
So it's hypointense on T1 and T2. What else? Compared with the other side, what does it look like? The capital femoral epiphysis.
It is abnormal outline and looks to be small in size.
شوفي كلمة abnormal in radiology means nothing. يعني شنو abnormal؟ أكبر، أصغر، larger, smaller, regular, irregular, infiltrative, destructive, mass-like, What do you mean by abnormal? بس abnormal وخلاص, it means nothing. You have to tell me what's the abnormality.
It's smaller in size.
It's smaller in size.
And hypointense.
Hypointense.
And it is
irregular outline. If you compare it, the left side has a very nice regular outline, while the left side is small, hypointense, irregular outline, capital femoral epiphysis. Okay, let's go to the T2 Fatsat. Wait, leave the mouse. Let's go to the T2 Fatsat and see what's going on. What's going on here? First of all, it is also hypointense. So it's hypointense on all sequences. On T1, on T2, on T2 Fatsat, everything is hypointense. Okay. Is there bone marrow edema?
Yes.
No. We don't see, there is no bone marrow edema. Bone marrow edema is hyperintense signal in the T2 Fatsat. Okay? And we don't see, maybe minimal, but not much, not significant bone marrow edema. Okay? What about joint effusion? Is there joint effusion? Yes, there is joint effusion. So, let's take a look at the axial images. We saw a lot of corona. Let's see some axial and determine whether it can help us or not. This is T2 weighted axial hip MRI. So, does it help us in any way? It shows that the difference in the signal intensity between the right and the left. Okay? So, what is your differential diagnosis of this case?
Avascular necrosis of the femoral head.
Avascular necrosis of the capital femoral epiphysis.
Yes.
In this age, you don't say femoral head because the growth plate is still open. When it's closed, you say femoral head. So the capital femoral epiphysis, avascular necrosis. Okay? What is it called? It has a name, this disease. Perthes disease, exactly. Usually we diagnose that on X-ray. Here, unfortunately, I don't have the X-ray. Okay? And we don't need to do an MRI to diagnose Perthes disease. It's a X-ray diagnosis. But here, it was requested for special circumstances. Okay? So Perthes disease. My question, the $1 million question. What is the most common presentation of Perthes disease? طفل عنده Perthes disease. What is his complaint?
Abnormal gait.
Abnormal gait.
Limping, pain.
Limping pain. Where?
In the hip joint.
Okay. The most common presentation. Loin pain لا. groin لا.
Falling.
Knee pain. Perthes disease most common presentation is knee pain, not loin pain, not hip pain, not limping, not all of this. No. At the Perthes disease, at the vascular necrosis of the femoral head, of the capital femoral epiphysis, they present with knee pain. That's why every child with knee pain do pelvis X-ray. Don't go for the knee. It's not important. Or at least do a femur X-ray, the whole from the knee to the hip. Okay, you have to image the hip joint in patients with in children with knee pain. Or not only children, people before closure of the growth plate of the femur. يجي knee pain, you do hip. طبعا his family will tell you why his hip is not in pain. Say them, shut up, sit down, do what I say. Okay? Good job. Thank you. يلا سينيور التيم. انت سينيور همين لو مو سينيور؟ جاي تدرب. اني اصلا ميديكال ستودنت بعد حتى ما واصله للبوست جراجويت. زين خلينا نشوف. صعب سهل.
دكتور والله اللي يقعد بهذا الكرسي ما يدرك يعني خليها ترجع.
ادخل.
والله يعني تبدا.
اتس بريزنت اي لانه تجيها باصات منا ومنا 234. اي bilateral perthusis. It happens يعني.
الكوجال والسكر والكورتيكوستيرويد.
ها قصدك يعني انه blood dyscrasias? Yes, of course. But it happens also idiopathic bilateral perthusis. It happens. Rare, but it happens every now and then. طبعا you should investigate more. زين. والله هي easy وبيج وobvious.
لا بالنسبه لي مثل ما انت
يعني شلون مبطل شو اسوي يعني؟ زين. This is a 27-year-old male patient presented with mass. أول شيء دقيقة. أوكي اتركي هذه. Just a second. Let's. شوية نزيد البرايتنس. يلا جو. اجى الموست سينيور الفاينل مالتنا. يعني اليوم شلون نقول كل الوزن عليك
ان شاء الله.
يلا.
اقول له بعيد.
لا اصبري هسه جايك الدور. لا تستعجلين. كل شيء بوقته حلو. So speak.
There is multiloculated.
What is this image?
This image is still
Never forget.
still of humerus.
This is what?
Still image.
No. Stair means fat saturated. Is this fat saturated? So,
T2 high.
This is T2 weighted coronal
Coronal
image of the
of
left
left
humerus, upper humerus حتى not humerus, showing
showing there's multiloculated bone lesion arising from from the diaphysis containing multiple fluid signal intensity.
So multiloculated, multiseptated cystic lesion arising from the proximal diaphysis of the left humerus containing multiple fluid signal intensities or different signal intensities of fluid.
No associated soft tissue lesion.
There is no associated soft tissue mass. However, can you judge that without looking at another plane? You don't judge from looking only at one plane. You have sagittal, axial and coronal. I would for me I would prefer to look at axial images. Okay, you can see multiple fluid levels and you can see it does not have a soft tissue component and it is invading or displacing surrounding structures. It's displacing, it's not invading. Okay, شوف لنا T1 image مثلا for example we saw T2. اخذي هذا الحلو هذا الاكزيال. يلا. Again you see fluid of T1 hyper intense. Can see areas of T1 hyper intensity suggesting what? Blood. And you can see the cortex of the humerus is what? No. Where is the cortex of the humerus here? Don't move. Where is the cortex here? This is the hypointense part, the cortex. Okay? And you can see it is here what? Lost. Gone. And you can see the lesion starting in the medullary cavity of the bone and going through here to the surrounding soft tissue. صح؟ اوقفوا خلينا نشوف هسه. شوفوا هسه هنا. This is entire cortex intact. تمام؟ And we go down and it's lost here. Okay? It's expanded here, thinned, and the lesion is going from the medullary cavity into the outside. Okay? Differential. First telangiectatic osteosarcoma.
تحمل aneurysmal bone cyst بس giant cell aneurysm.
Aneurysmal cyst, bone cyst وشنو؟
giant cell tumor.
Giant cell tumor.
Dislocation ويعني.
Which شنو اللي not dislocation?
يعني giant cell tumor.
Giant cell tumor is not
in the subcortical area.
Usually subarticular area. Okay.
Aneurysmal not in this age شوية younger. وهم not يعني expansion وهم in the sub يعني articular area sub cortical.
Aneurysmal bone cyst can arise anywhere. It even arises in lesions. And you can have giant cell tumor and aneurysmal bone cyst arising within it. Secondary. Okay? يعني even it arises in other lesions. شوف giant cell tumor and then within it aneurysmal bone cyst. Okay? Telangiectatic osteosarcoma, I'll give you that. However, you cannot have telangiectatic or osteosarcoma this big without invasion of any structure, and multiple fluid levels without soft tissue component are not in favor of telangiectatic osteosarcoma. Third, he's 27 years old. This is not the age of osteosarcoma. Osteosarcoma occurs in much younger, except in patients with what? With Paget disease, which is much older, like 60, 70 years old. They will have osteosarcoma.
Secondary osteosarcoma.
Yeah. So, which is the top differential?
Aneurysmal.
This is most likely to be aneurysmal bone cyst. It has multiple fluid levels. Some of the fluid levels has a blood signal intensity. It is arising from the medullary cavity of the bone and extruded to the outside. It has no soft tissue component. It is displacing, not invading, not extending to other structures. It's long standing from the history, which you didn't ask. It should not be done. There should not be loss of cortex. However, this is very big in the medullary cavity. It's just يعني لازم يلاقي له مكان يروح. erosion, let's say. Okay.
بس العفو بس بداية بس تحدد وبعدين شلون يكسبان هذا يعني من المدرج بداية
هذا الكورتكس سي شيبت صاير. ليش؟ لانه هنا lost lesion منه and is going out. Would you do a biopsy for that?
ليش blood يعني bleeding.
It is very vascular tumor. Don't touch it. He will bleed. Don't touch it. Okay? Especially if it is in a place that you cannot compress. يعني هذا we can compress. We will manage if we need it. طبعا this is typical, so no need for biopsy. Okay? And again, one of your fatal mistakes, musculoskeletal mass or case, and you didn't ask for an X-ray. And I always say, if there is a musculoskeletal case, before you start, you say, I want the X-ray. Before everything. I tell you, I don't have an X-ray, and then you continue. You always ask for an X-ray in any musculoskeletal case. Otherwise, you'll lose a lot of marks. Okay? It is one of the differentials. It is one of the differentials. However, not the first differential. Okay? زين. يلا يا سينيور. قوم خلينا نجي فد شيء يليق.
لا والله ابدا لا يليق.
بمقامك.
يعني اسهل شيء يعني احتمال اسهل شيء.
لا سهل. والله سهل. والله المفروض سبوت. 2 4 خلينا نشوف. This is a male patient. He's I think 20 something years old. Okay, presented with swelling in the face. Okay, so what I will do to make your life easier, I will give you the coronal, the axial and the sagittal all at once. وين يا أحمد؟ أوكي هذا coronal وهذا sagittal, and you can have all the data you want. And just a second, wait, let's zoom in a little here and there and here, and the steering wheel is yours. First of all, what's the exam?
CT, coronal, sagittal, and
CT of what?
CT CT head, neck.
Head and neck,
Yes.
with or without?
Without contrast.
With contrast.
This is with contrast.
Okay, كلها with contrast. هو نفس السيكونس كلها.
Okay.
So this is CT of the head and neck with IV contrast, axial, coronal and sagittal image, soft tissue or bone window.
Soft tissue.
سوفت تشو. طبعا هاي المفروض ما اسحبها منك سحب بيجي، المفروض يعني انت تتبرعي لي بهاي المعلومات. Showing what?
Swelling in the face. Presentation.
Swelling وخلاص الله اعلم مش مدريني وين. انت قولي لي وين السويلنج. swelling بالهيد والنك. عليكم السلام. بس اجى المور سينيور من عندك بعد. يا احنا بدنا ندور يعني شلون نقول increasing levels. اول شيء كان عندنا ماستر، بعدين اجانا سكند، بعدين اجانا ثيرد، بعدين اجانا فاينل، بعدين اجانا بوست فاينل.
مو دكتور؟
ها؟
خاف ما تلقى واحد ترزق أحد.
لا يا بلا سوري يا الله ما نرزل احد. So اي بالضبط. So what do you see abnormal?
No, I didn't catch it.
Come on. Really? زين
Maybe this.
زين قومي عيني الفاينل مال القاعدين كبير القعدة تفضلي. كبيرهم الذي علمهم السحر. هذا 20 years old male patient presented with a swelling in the head.
Head.
هو هذا CT head and neck. Okay? With أول شيء قولي لي what's the exam?
CT head and neck with contrast.
حلو. soft tissue low bone window.
لا بوست يعني هذا soft.
soft tissue window.
نعم.
Okay? coronal axial and sagittal.
نعم.
First of all
خالد نيتف أشوف.
ما عندي نيتف.
ما عندنا نيتف. Okay.
طبعا good question يعني you get score for that. So first of all I want you to find the swelling. Where is it? So that we can discuss it. Watch the whole thing before saying anything. Have all the data you can, then solve. انزلي بعد كملي للأخير. See everything before you say anything.
Okay.
طلعت هسه الشطارة.
يعني هنا
Yeah. You see a big irregularity in the where?
in the left lower jaw.
In the left side of the mandible, in the body of the mandible. So when you see this, you ask for what?
Bone window.
Exactly. Good. Let's see bone window. This is the bone window.
Yeah.
Describe what is there.
Uh,
Okay. First of all, let's zoom in a little حتى we have more and let's go for just a second حتى شنو اوكي yeah go. What do you see? أو describe what do you see بالحقيقة.
there is osteolytic lesion
Mm-hmm.
involving the left side of the mandible.
Osteolytic lesion involving the left side of the mandible.
Surrounded by periosteal reaction.
Which kind of periosteal reaction?
Sunlight.
Sunburst appearance.
Sunburst appearance.
Okay.
Two lesions actually are present. يعني مو
ممكن multi يعني the same lesion involving
involving more than
two lesions will get you into trouble.
same character.
The same lesion
Same
is
character.
have multiple foci خلينا نقول.
Involving more than one
Okay.
place.
So if we scroll it, do we have a soft tissue component or not?
Surrounded with
Let's go to the soft tissue window. Where is it? Where is it? Where is it? Yeah, let's see that. Do we have a soft tissue component or not? There is a big soft tissue component in the left side of the mandible. Okay? Does it destroy the bone?
Yes.
It is a destructive lesion. It's a lytic lesion. It has a sunburst periosteal reaction. So,
Wide zone of transition.
and wide zone of transition.
No.
Is it an aggressive lesion or not?
It is aggressive.
It is definitely aggressive. Okay? It has all the aggressive features, which are شنو الفيتشرز of aggressiveness?
Construction,
Bone destruction,
soft tissue involvement,
soft tissue component,
and good sunrise periosteal reaction.
periosteal aggressive pattern of periosteal reaction, and a wide zone of transition.
Wide zone of transition.
Okay? What's your diagnosis? Not differential, diagnosis. This is spot diagnosis. This is osteosarcoma of the bone. He's 20 years old. Ewing is much younger. Okay? This is osteosarcoma of the mandible. It's a rare location for osteosarcoma. However, it happens. طبعا biopsy proven osteosarcoma. شوفي Ewing sarcoma from personal experience. Ewing sarcoma always present with huge soft tissue mass. مو soft tissue component. Huge soft tissue component. Okay? يعني كل ما تشوفين big soft tissue component in something that involves the bone كتبيها Ewing وعليه. Regardless of the age, regardless of the presentation, regardless of the sex, regardless of whenever you see a huge bone related soft tissue mass شرط تكون bone related يعني surrounding a bone or arising from a bone or with some bony abnormality, something with the bone, big soft tissue mass. معليش بالايج، معليش بالبرزنتيشن، معليش بالسكس، ليف كل يقول واحد عمره 35 years old with big soft tissue components surrounding the femur Ewing. و 99.99% of the time it will be Ewing.
تتحمل يعني differential بالأخير osteomyelitis؟
No.
Possible بس unlikely. Chronic osteomyelitis might بس الsun ray is not in favor. The soft tissue component is not in favor. If it's chronic osteomyelitis, it will fistulate to the skin, which we don't have exactly. Okay, so and he will have features of fever and recurrent infection, recurrent swelling and de-swelling, something like that. Not like this. It's arising from the bone, destroying the bone, surrounding soft tissue components, sunburst appearance, periosteal reaction. And by the way, Ewings usually present with onion peel periosteal reaction. Rather, not always, but typically presents with onion peel rather than sunburst. Sunburst more in favor of osteosarcoma of the mandible. Okay? I think we don't have any more time. Thank you very much. See you next week, inshallah.